All right, this is Jessica Lasowski, and I'm going to do my next physical assessment. First, I'm going to start with the upper extremities. I'm going to inspect them. I'm going to look for size, symmetry, um, uh, bilaterally. Then I'm going to look for any edema, swelling, anything like that. I'm going to check some venous patterns and make sure that um, there's no abnormalities there. I'm also going to check for color, making sure appropriate for ethnicity. I'll move on to the lower extremities where I'll do the same. I'll check for size, symmetry bilaterally. I'm also going to check for any edema in upper, lower legs, feet, ankles, anything like that. Check for any swelling. I'm going to look at venous patterns. I'm looking for spider veins, anything that could indicate DVTs or SVTs. And I'm going to check at color as well, making sure that it's appropriate for ethnicity. I will move on to palpating the upper extremities, checking for temperature, making sure that it's appropriate. He's warm, dry, and it's appropriate for the environment. I'll next check his radial pulse and brachial pulse. And then I'll move on to palpating the lower extremities. Again, I'm going to check for temperature, making sure he's warm, dry, appropriate for the environment. Um, palpate for any edema. If there is any, determine what degree it's at. Next, I'll check his femoral pulse, if you could lay down for me. Okay. All right. And then I am also going to check while he's here, and you can see the feet. I'm going to check his dorsalis pedis, which is a really good indicator of circulation throughout the lower extremities. Go ahead and sit up for me, sir. I'm going to check a popliteal pulse, which is one that's very difficult to feel. Okay. I'm sorry. Go ahead and lay back down for me, sir. I'm also going to check the posterior tibial. Another good indicator of lower extremity circulation. All right, sir, go ahead and sit up for me. Then I'll move on to inspecting the head. I'm going to look at the hair, making sure that it's normal, any abnormalities there. I can also inspect the scalp, looking for anything that would indicate any sort of infection, inflammation, anything, dryness, anything that's out of the normal for him. Checking the skull for symmetry, any sort of deformities. Look at the face for symmetry, making sure that it's normal, especially for him. And checking the skin as well, looking at color, things like that, making sure that it's appropriate for ethnicity. Okay, if you could face the camera for me. We'll next move on to inspecting the eyes. We'll inspect the external eyes, looking for symmetry, things like that. Checking the eyebrows, also a good indicator for things like stroke, that there's symmetry. You can have, go ahead and raise your eyebrows for me and lower them. And good indicator of good muscle movement in the face. I'll next look at the eyelids, also checking that they're appropriate, check the skin, that there's nothing that indicates any inflammation, anything like that. I'll check the conjunctiva. Go ahead and open your eyes for me. Redness there could indicate inflammation, infection. Check the sclera, making sure that it's appropriate for his ethnicity, looking for any deviations in color, anything like that. Next, I'll look at pupil size, shape, as well as direct reaction and consensual reaction. Go ahead and look straight ahead for me. I'm going to shine the light into your eyes. And you want to make sure that those are reacting equally. Next, I'll inspect the ears, looking at the pinna, auricle of the ear, both sides. Okay. I'll next inspect the nose, looking at the external nose, the nasal mucosa, as well as the nasal septum. Septum is important too to inspect before you put in something like an NG tube. You want to make sure that you have a patent airway to go through to put that through. Next, I'm going to palpate his sinuses, checking for any swelling, tenderness, anything like that. Check the frontal. Any tenderness?
No.
And the maxillary, any tenderness?
No.
Okay. I'll move on to the mouth area. I'll inspect the lips. We want to look for any dryness, cracking, anything like that. Symmetry as well. Then I'll check the oral mucosa, the gums, the teeth, the roof of his mouth, his tongue, the floor of the mouth, as well as the pharynx. Go ahead and open wide for me. Go ahead and lift your tongue up. Tongue out and say ah for me. All right. It's good to look for color, moisture, making sure everything is pink and moist, looking for any abnormalities inside, anything that it could indicate that there's any issues. Then I'll inspect the neck. I'll look at the trachea, as well as inspecting the thyroid. Next, I will palpate the trachea and the thyroid. Check for any deviation, any tenderness or swelling. Palpate the thyroid, any tenderness or swelling. Do you feel any tenderness?
No.
Okay. Then I'll move on to palpating the lymph nodes. I'll start with the pre-auricular, the posterior auricular, the occipital, checking for any swelling, any tenderness. Do you feel any tenderness?
No.
Okay. Then I'll check for the tonsillar lymph nodes. All right. The submandibular, the submental, the superficial cervical, the posterior cervical, as well as the deep cervical chain. Next, I'm going to check the supraclavicular. Any tenderness?
No.
As well as the epitrochlear. Okay, and that concludes this physical assessment. Thank you.